So cefuroxime, cephalosporin. So again, this is based on MIMS Asia. Famous brands in Asia and probably in other parts of the world to include is probably one of the most famous brands is Zenat. Okay, so for adult and children above 12 years old, the usual course of therapy is 7 days. Okay. So it's about 7 days, which is actually 5 to 10 days. So it's between 5 to 10 days. Okay, so to make it easier to remember, I just wrote 7 days. So for most infections, the dose will be 250 milligrams twice a day. Okay, so remember this is cefuroxime, 250 milligrams twice a day. For example, for UTI, the dose is a bit lower, 125 milligrams twice a day. For mild to moderate lower respiratory tract infections, example bronchitis, it's a standard dose, 250 milligrams BD. And for more severe lower respiratory tract infections, or if pneumonia is suspected, then the dose is doubled to 500 milligrams BD. And for pyelonephritis, this should be down here, okay, by right, because this is not the same system. This is not from the respiratory tract. So pyelonephritis, in the urinary tract system or the genitourinary system, so the dose is still the same, so 250 milligrams twice a day. And for uncomplicated gonorrhea, so this is good, 1 grams as single dose, okay, and you're done. Just 1 gram in a single dose, 1 stat dose for uncomplicated gonorrhea. So remember, this is for cefuroxime. For children, for most infections, it's 135 milligrams BD. Okay, maximum is 250 milligrams per day. So for otitis media or more severe infections, it's 250 milligrams twice a day, and maximum of 500 milligrams per day. For suspension, for children of the age of 3 months to 12 years, for most infections, it's 10 milligrams per kg twice a day. So, for example, if a child is 10 milligrams, then it's 100 milligrams twice a day. Okay, so 100 milligrams twice a day. So it's close to this dose. Okay, so maximum is 250 milligrams per day of cefuroxime. For otitis media and more severe infections, it's 15 milligrams per kg twice a day. So if a child is 10 kilograms, then it's 150 milligrams twice a day, to a maximum of 500 milligrams per day. So this is taken immediately after food, okay, and the presentation usually is Zenat, or it's cefuroxime oral suspension, 135 milligrams per 5 mils, which is 25 milligrams per mil. And also you have the 250 milligrams per 5 mils, which is 50 milligrams per mil. Okay, 50 milligrams per mil. So, and you have the Zenat tab, which is 250 milligrams of the tablet. So indication includes the upper respiratory tract infections and also lower respiratory tract infections of the various forms of those infections. So for upper URTI, tonsillitis, pharyngitis, so infection of the middle ear, otitis media, infection of the sinus. And then for lower respiratory tract infections, of course, it will include bronchitis and also pneumonia. And then it covers for genitourinary tract infections such as pyelonephritis, cystitis, which is inflammation of your urinary bladder, and then infection of the urethra, urethritis, and then skin and soft tissue, furunculosis, pyoderma, impetigo, etc. So, and then also gonorrhea, so which is a sexually transmitted disease, STD. And if you still remember, for gonorrhea, the cool thing is it only requires 1 gram as a single dose, 1 stat dose, so if it's uncomplicated. So what are the adverse effects? What are the unwanted effects of cefuroxime? So candida growth of candida, infection, eosinophilia, increase in the eosinophil count, gastrointestinal disturbances, okay, and also a temporary increase in the hepatic enzyme levels. So if it's temporary, so not much of a problem. So for pregnancy category, it is B. Okay, it is B, category B. Okay, so not bad again, just as it was with moxicillin. And for lactating mothers, you have to use with caution. So till we meet in the next video. Okay, thank you.